Delhi is witnessing a rise in seasonal influenza cases with 2,308 H1N1 cases reported so far and another around 600 to 650 cases of other flu infections, taking the total reported influenza cases to nearly 3,000. Well, the rise has prompted increased monitoring by health authorities, but officials have maintained that there is no need for panic. As Delhi Health Minister Pankaj Singh said that the government is fully alert and prepared to handle the situation. The health department is continuously monitoring cases and has directed officials to follow the guidelines issued by the centre. Authorities have also reviewed the preparedness of hospitals, with the government saying that sufficient beds, doctors and medicines are available. And according to the health minister, patients are largely reporting normal fever and flu-like symptoms, receiving treatment and recovering. He also said that so far no deaths have been reported in Delhi from the situation being discussed, and no patient is currently on a ventilator or in the ICU, according to the figures shared by him. Well, the rise is not limited to Delhi. Health authorities are monitoring respiratory infections across India through an expanded surveillance network developed after the COVID-19 pandemic. And around 73 laboratories are involved in surveillance, with samples being tested regularly to identify which viruses are currently circulating. ICMR Director Rajiv Behel said that surveillance data indicates that H1N1 is currently circulating at a high level, while influenza B and some COVID-19 cases are also being detected, and this means that the current respiratory illness situation involves a mix of influenza A, influenza B and COVID-19 infections, with the data being reviewed week by week. Importantly, officials have clarified that the current H1N1 infections are being treated as seasonal influenza, not a new virus or a newly emerged dangerous strain. Flu viruses regularly undergo mutations, which means that having influenza in a previous year does not necessarily provide protection against infection this year. And most infections are expected to remain mild, but health authorities say that people at higher risk, including young children, adults over 65, pregnant women, and immunocompromised individuals should be more careful. And for the general public, doctors are advising basic precautions, and people experiencing flu symptoms should get adequate rest, drink plenty of fluids and maintain good hygiene. Since influenza can spread through respiratory droplets, people who are unwell should avoid close contact with others, particularly in crowded settings. Frequently touched surfaces should also be kept clean, and people should avoid repeatedly touching their eyes, nose and mouth. Authorities have also advised people not to self-medicate with antibiotics, as influenza is a viral infection and antibiotics do not treat the virus. Antiviral medicines may be considered for people who are at higher risk or develop severe illness, but they should be used under medical advice. And the Delhi government has also urged people to remain cautious in crowded places, follow respiratory hygiene and seek medical attention whenever necessary. Anyone experiencing breathing difficulty, chest pain or worsening symptoms should seek medical care promptly. And flu vaccines are also available in India, and vaccination is particularly recommended for people at higher risk, although officials have clarified that it is not mandatory. So while Delhi's H1N1 count has crossed 2,300 and total reported flu cases are nearing 3,000, health authorities are stressing one key message, that is to stay alert, follow precautions and seek timely medical care, but there is no need to panic. That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.